Hello and welcome. And today I'm very pleased to introduce Dr. Meg, who is going to talk to us about something called regenerative aesthetics, which is an emerging and a very exciting field of an alternative, I think you would call it, to cosmetic aesthetics, because this is far more concentrating on actually healing people who have problems with skin conditions, which Dr. Meg's going to talk about. So, welcome, Dr. Meg.
Thank you. Thank you for inviting me. Very
Um,
happy to be here.
I think what would be really interesting if we started with your background, because your background, when we hear about it, absolutely leads to why you're doing what you're doing now in many respects.
Yes.
People may be quite surprised.
Yeah, I think that is the case. I was an eye surgeon for 20 years, an ophthalmologist, and I had a busy NHS post as a consultant and had been a consultant for almost 10 years. My area of expertise, like all ophthalmologists, we do high volume cataract surgery. But my area of specialization was pediatric ophthalmology and eye movement disorders. And this also encompasses neurological muscle spasms and things in the face. So I had a vast 20-year experience with something that people are very familiar with called botulinum toxin. And ophthalmology was actually, interestingly, its first use in medical practice. And this is for the treatment of eye movement disorders. So I used to inject botulinum toxin into eye muscles of babies and adults in order to straighten their eyes.
We're talking
And
Botox, aren't we? Botox.
Botox, yes.
Yeah.
And it's a bit of a, misnomer. Botox is just one preparation of a number of different preparations. It's the botulinum toxin A preparation made by a company called Allergan. And it's sort of become synonymous with the drug, which is botulinum toxin, which is a powerful neurotoxin. And the same in my neuro-ophthalmology clinic, we looked after people with facial tics and spasms. And so these are actually the same muscles that we inject in order to soften people's wrinkles. And I guess now 10 years on, I've got, 30 years experience with botulinum toxins. So sadly, well, not sadly, I had to stop work suddenly. It was a happy ending, which was the main thing. One of my children became very ill. And so I took a career break, and that's why I moved. And in returning to medicine, which is my first love, and I really missed seeing patients, and it really made me appreciate what sort of privileged job it is being a doctor and being able to look after people and having that contact with people. So I moved into this area of aesthetics, which I have to say I was, quite ambivalent about. The industry has all sorts of concerns. There's a total lack of regulation. There are lots of unscrupulous practices, very commercially driven practices, and that's obviously entirely different to my old world of NHS therapeutic medicine, which is all, evidence based. We have good research for the treatments that we're advising patients on. But it's actually very exciting. There's an emerging area, as you alluded to in your introduction, which is termed regenerative aesthetics. And this is really what I've become entirely focused on in moving into this area. And it utilizes my experience as a surgeon and my understanding of anatomy and my ability to guide patients, I think, through a very, very swampy area, and to treatments that actually make a difference, can improve the health of their skin, the longevity of their skin, and treat a number of medical concerns like rosacea and acne, precancerous conditions on the skin, and using these newer technologies to really make a difference to the longevity and health of skin, rather than just a kind of a photo finish, which is, I think, what's going on in the majority of the aesthetics industry, and what makes people are very vulnerable, I think, when there's all these different treatments out there and they can't get advice which is, comes from a point of integrity as opposed to commercial interest.
And I think that's always very difficult, isn't it? As soon as you go in, because these treatments, or I presume many of these treatments aren't available, or presumably at some point they will be on the NHS. So we just take it for granted that everything that we go and have done at the NHS is fine and it's safe. But as soon as we then can start shopping around ourselves, it's a different matter. And then you need to look, I suppose, at, you look at how much it costs. Do you go for the cheaper option? And it is an absolute minefield. And I think, as you were saying earlier, before we started recording, about the fact that there's not much regulation in this field.
Yeah, it's a huge problem. It is coming. It's very slow, but there are now finally moves to make this happen, and to regulate the industry. But it is an extraordinary situation here in the UK that we've had this situation, which is, we're totally unique in that, that we don't have regulation, and it's not to say that you need to necessarily have someone medically qualified to do many of these procedures and treatments, but you do need someone with proper qualifications and experience and training. So yeah, we're all waiting for that and welcoming the changes which are now finally starting to happen.
Oh, that's really, I think that's really assuring for people, isn't it, to know that they're going to, because you're putting things into your face that you don't know where it's come from, where it's been tested, and all those sort of aspects. So anyway, moving on to, so what actually is regenerative aesthetics?
So it's essentially an area that's come from the larger realm of regenerative medicine. So these are treatments which are focused on improving and regenerating often aged or diseased tissues. And there's a number of different treatments. So things like phototherapy, people will be familiar with something called IPL for hair removal. But actually, this is a technology that's been used for many decades in the treatment of skin conditions to rejuvenate skin and actually stimulate your body's own repair mechanisms. And I think that's really what's at the crux of regenerative medicine and aesthetics, is that we're using really sort of groundbreaking science to help our body repair from inside. And by stimulating cellular mechanisms inside your DNA and RNA, deep inside your cells, to essentially reprogram those cells and turn the clock back. And whether that's in the landscape of disease or aging, that's essentially what regenerative medicine and aesthetics is about. So it's very different to the sort of cosmetic side of just, for example, dermal fillers people are very aware of. There's a sort of practice of filling up, slightly saggy aged skin and trying to replace that with some volume. And, that will give you a temporary improvement, but it's not actually addressing the skin laxity itself. Whereas some of the newer treatments within regenerative aesthetics are injectables or light treatments that stimulate your own cells to continue producing collagen over time. So you are repairing that process and actually redensifying the skin and restoring the skin to its former status. And critically with that then is you're not changing people's morphology. You're not making them look different or strange. And you are helping people to return perhaps to how they looked when they were happier with their appearance and they weren't worried about some elasticity and wrinkles. And
but I think the thing that is most interesting is actually, though, how it does really help people with severe, well, I don't know how, it would be interesting to know how severe, but you mentioned previously rosacea, acne, pigmentation, scarring, things like that, which really do have an impact on people's life based on how they feel about themselves, their confidence, etc.
Definitely. And that's probably to me the most exciting area of the applications of these technologies, particularly, I mean, certainly acne, rosacea, also precancerous conditions on the skin, such as actinic keratoses, the phototherapy, and to some extent, newer treatments like polynucleotides are really effective at treating these really difficult to treat resistant conditions that really dominate people's lives, as you say. I mean, the psychological morbidity of people who have to, deal with these things every day, it's really, really heavy. And I think particularly with rosacea, because with acne, there are effective treatments. They may have some really unpleasant side effects and risks and toxicity, but at least the treatments generally tend to be effective. But with rosacea, I think the treatments are really inadequate. They're not very efficacious. People continue to struggle on a daily basis to control redness and inflammation in their skin. And the phototherapy is really life-changing, actually, and it's making the skin better because it's actually reducing the inflammation. So it's a chronic inflammatory disease, and the phototherapy actually alters that inflammatory process, so it stabilizes the inflammation. So it doesn't just temporize; it's treating. And I like to use the word cure because you do need some ongoing treatments. You'll still be living with your condition, but it will be something that you can live with, and you might have an occasional treatment for once every couple of months, as opposed to battling with every day.
So lots with rosacea, for example, I mean, for many people, rosacea is, they're fine, and then suddenly they just have a flare up, just like that. It can just happen. Is this appropriate treatment for people with rosacea like that?
Yes, absolutely, because it is actually affecting change in the inflammatory driver for the condition. So it will help stabilize the sebaceous glands, which are what becomes triggered in, people have different triggers. But if you've treated the sebaceous glands with phototherapy, then it stabilizes that inflammatory process and prevents outbreaks. Exactly, it prevents you reacting. So it treats inflammation, which is there. That's one arm of the treatment protocol. And then the other arm is to prevent and stabilize the condition. So we can't cure it, but it almost feels like a cure to people, because they might come once a month or once every 3 months just to have another session to top up and continue keeping that inflammation at bay. And that prevents outbreaks.
So the actual treatment that you're talking about, and I think the one that you practice, to explain, what happens if I come into you and say, right, I have rosacea or, skin pigmentation, what would you do?
Yeah, so we obviously, need to make sure that a lot of people come to me that they've been looked after by a dermatologist, and so there's a very clear diagnosis, and people have had certain treatments with various different efficacies. Sometimes people come to me having not seen a doctor, and so we need to establish a diagnosis. So that's the first part of the assessment, is to take a really detailed medical history to understand really what's going on and what the cause of the problems are, and to assess the skin. And then once we've established what the concern is, and in something like rosacea, typically people are concerned about broken capillaries on the surface of the skin, redness, this sort of reacting to certain situations, whether it's exercise or alcohol or sunlight, whatever your triggers are. Then we would normally do, well, certainly one treatment and see the response. Typically someone with rosacea might need 2 or 3 treatments in order to really get on top of the current inflammation. And then they'd come back for a maintenance treatment, maybe in a month, 2 months, 3 months. Everybody's different, and it depends how effective the treatment is in you. The treatment tends to be most effective in people with type 1, type 2 skin, which are the group that we see a lot more people with rosacea in anyway. And essentially the treatment.
And what's that? What's type 1 and type 2? Is that fair?
So this is a skin typing, the Fitzpatrick skin typing, which types skin from 1 to 6 based on your response to tanning and your eye color and your hair color. And it's a way of, and it's used throughout dermatology for lots of different reasons. And it helps define your risk of things like skin cancer. And it also very important when you come to treating people with phototherapy, because the amount of pigment in your skin will determine how much energy is absorbed during the treatment. And so phototherapy is particularly effective in people with lighter skin and skin types 1 to 3. But it can be used safely in skin types up to skin type 5. The only limitation, which is a bit frustrating, is it can't treat people with skin type 5 with the darkest skin color and eye color.
And would that be somebody we would say with color? They've got a really quite dark skin.
Yes, really dark skin, very dark eyes, and really no propensity to burn in sunlight. Yeah.
Oh, that's interesting. So once you've had your initial one, and then you think, right, well, just go see how my skin reacts. I'll have a top up, and then from there on, is it a continual every sort of 3 or 4 months, or is it a yearly appointment? Or
yeah, it could be as infrequent as 6 monthly or even yearly. It depends obviously very much on the severity of your inflammatory condition as to how long the preventative treatment works for. I think that's and so it is difficult to give kind of hard and fast rules. And obviously with rosacea, there is a lot of, avoidance and lifestyle. So people who can't avoid certain things may need more maintenance. So if it's stress, for example, which is very difficult to avoid in life, then they may need to come for top-ups more frequently. But if your triggers are ultraviolet light and wearing sunscreen keeps things at bay, once we've got the inflammation under control, you might only come once a year.
But I think it's like all treatments, isn't it? Nothing on its own actually is going to be the thing. It's how you manage it along with everything, what you eat, how much water you drink. It's all a combination, isn't it?
Absolutely. I mean, that's right. I mean, every and we're understanding more now how sort of multifactorial all disease is, and how things like the microbiome and stress and all these other things are so significant in disease and how it plays out in our bodies. Yeah, absolutely.
It's interesting because you mentioned before about precancerous. So I'm presuming that you're talking about acting. You mentioned
actinic keratosis.
Yes. Again, and so I would normally associate that with men who have lost their hair, and so they get it. So you would treat the head as well as the face.
Yeah, well, I think if people, in order to, some of the treatments for actinic keratosis are a little bit unpleasant, and they're not very targeted. And so, yes, if someone is able to come for treatment, that's right, we can remove the actinic keratosis anywhere on the body, the head, the face. But typically, that's right, they do occur usually in the upper part of the face, in the most exposed areas. So often here around the eye area, and certainly in men who've lost their hair on the top of their head. And we can remove the lesion with phototherapy. And then there's no requirement for surveillance, and it's obviously important because typically these things occur on a background of photo damage and a number of different moles and other lesions. So obviously I'm not saying people shouldn't still have surveillance, but just for that very specific lesion, having removed it, then the risk of it transforming into a squamous cell or basal cell carcinoma is then, that's it, there's no more risk. It's been treated, it's been removed. So that's a great area. And the same for moles and pigmentation. If you can remove these lesions, then it reduces the risk of transformation into
And
skin cancers.
I know it sounds silly. Does it hurt? Is there, do you come out very red, or what's the, is there a
Yeah, no, it's a really good question, and that's all people always ask that, and I think that's one of the reasons I really like working with it, is because there's very, very little downtime. It's a very, very acceptable treatment. I think, the older IPL systems are associated with some rather snappy, unpleasant pain on the surface of the skin. But with these really advanced technologies now, we've got you've got a cooling system integrated with the light delivery. Then it's not unpleasant at all. And there's one maybe in the acne protocol in order to, when we clear the bacteria, it's the most superficial wavelength blue light to treat surface bacteria. That can feel a little bit snappy. But that's probably the only thing that people ever sort of say, oh, okay, that I just felt that. So on a sort of scale of 0 to 10, they might say 4, for a little snap. But it's a sort of, they're individual snaps as opposed to something with, painful that's continuous. So they're really, we generally say they're not painful because people don't find them painful. Some people even fall asleep during the treatment, finding them quite relaxing, and it's a sort of warm feeling on your skin typically. So it does generate heat within the skin, but not an unpleasant warmth.
You mentioned acne again, and so is this an alternative for putting somebody on Roact?
Yeah, absolutely. Yes, it is, absolutely. Yeah, and that's where, again, it's a really great treatment modality, because you avoid the risk and side effects of long-term antibiotics and Roaccutane issues with forming antibiotic resistance and all the sort of myriad toxic side effects that people are familiar with Roaccutane. So it really is a very, very different, far more acceptable, and it prevents scarring through the deeper wavelengths that we use. It can also prevent scarring. So it really is a kind of 360-degree treatment for acne, because the first stage clears all the bacteria, which are driving a lot of the inflammatory process. The longer wavelengths treat the redness and the inflammation. And a bit like in the rosacea protocol, we use deeper wavelengths to actually stabilize the sebaceous glands and stimulate collagen and the glycosaminoglycans in the skin, which would then help mitigate any scarring. So it's a highly effective treatment. Yeah.
Right. And I'm sure you can guess what my next question is. Age. Is there an age limit on it, or?
Well, I think it's you can treat teenagers even as young as sort of 13 and 14. I think, when you have the treatment, you do have some occlusive eyewear, so you have to completely cover and protect the eyes, and some adults actually can find that a little bit alarming. So it depends how nervous the person is, but I think yes, you can certainly, it's really effective treatment at any age. It's just a question, and there may be adults who don't like having their eyes covered or feel funny, or but generally you can talk people through it, and it can be, it's a really acceptable, pleasant treatment, and usually people come and are highly motivated because they know they don't want to be on your Accutane, or they've tried your Accutane and found it completely unacceptable. So usually
it's quite a regime, isn't it?
Yeah.
So and the side effects are not necessarily. No, I think that's absolutely. I'm sure that's sort of for many people, and especially as you get older. When people find that they, suddenly hit the menopause and suddenly acne suddenly comes back again.
Exactly.
It's a real alternative for them to think about, and the bonus of looking potentially slightly, I don't want to say younger, but
no.
but slightly more restored.
Well, the thing is that, as in the menopause, that loss of estrogen is terrible for our skin. We become extremely dehydrated, and we lose a lot more collagen. So the attrition rate of collagen rapidly decreases, and so rapidly increases. And so yes, it's a really lovely, supportive, sort of regenerative treatment with that benefit. Yeah, and it improves the skin globally, as well as treating these sort of hard to treat, annoying conditions like acne and rosacea.
No, that's great. And I think one sort of last thing to wrap it up with, you've mentioned previously that there's a lot of things going on in this area that are
Yeah.
coming soon in developments. Could you shed some light on what we can hopefully expect to see in the next few years?
Yeah, I mean, it is a rapidly growing area. I mean, these are already, I think there's quite a lot of awareness of polynucleotides, which are fragments of DNA purified from salmon and trout sperm. And these are really interesting molecules. They've actually been around for a long time, but because people haven't been necessarily interested in their effect on wound healing in diabetics. They haven't sort of received the same impress as they have now that they're moving into the world of aesthetics. But these actually work in a really similar way to the phototherapy, and they are actually stimulating your skin to repair itself from within. So they're a really interesting area. And they also are helpful at they have anti-inflammatory properties, so that they can be used in conditions like rosacea, and they also stabilize melanocytes, so they're helpful for pigmentation. So they're definitely very interesting, and we use those, and they're available. There are other interesting things as well, like they're called exosomes, and these are cellular signalers that have been either purified from stem cells or plants. And I think this is where there is some difficulty in the industry without any regulation. There are a lot of these products actually freely available at the moment, but they don't have robust provenance and ethical clearance, or even patient safety clearance. So I think that's the kind of takeaway, is there are lots of interesting things coming, but don't be, too quick to jump on the bandwagon. Make sure you go to, a provider that you trust, who is really going to have looked at the limited research that typically is available in the area of aesthetics, but that has actually got patient safety at the forefront of their mind, rather than a commercial interest.
But it is, as always, in all of this areas, do your homework.
Absolutely, yes. I mean, nowhere more importantly than this industry at the moment. Once the regulation comes in, it will be much easier for people to navigate and not fall foul to unscrupulous practices. But yeah, so for now, absolutely, really do your homework.
Excellent. Well, I'll be visiting very soon. That's all I can say. Thank you very much. It's a real pleasure.
Yeah.
Thank you, Dr.
Thank you so much.
Thank you.
Bye.